Good morning, afternoon and evening to everyone who's attending the International Humans in Space Summit. I thank the organisers for accepting my abstract on Earth observation technologies for the benefit of human health on Earth and in space. Now, before I actually did this project, I was unaware of the true repercussions of Earth observation as a potential tool to forecast and manage resources during large pandemics like COVID-19. And I think it's important just to take some time to remember, think back to your experience of the pandemic. Now, this is our team. This just gives you a flavor of the multiple disciplines, public health doctors, engineers, hospital physicians, and students based in the US and across Europe that participated in this study for the NASA Space Apps Challenge. We came together during the pandemic in autumn of 2020, so a long time ago now, to try and solve this. This infographic from ESA really tells you in one picture, it illustrates that Earth observation is pivotal for medical and biomedical research. It's important for remote diagnosis and management, telemonitoring, telemedicine. So you can take ECGs in South Africa and transmit them to Europe for an expert in, say, atrial fibrillation to have a look at. It's also important for public health management and logistics for public health agencies like UN-USA and the WHO, and very important for emergency and disaster management in terms of what we know from human and robotic exploration and drone technology from the space sector. Now, I'm just going to zoom in on Earth observation as one of those things. Now, the pandemic itself requires no introduction. You've had some time to reflect on your own experience, but depending on where you were in the world, the novel coronavirus at the time was circulating among animals and then transmitted to humans. And this was first identified as the novel coronavirus, SARS-CoV-2, in China at the end of 2019. It was not something that we'd seen before in humans. The key things that public health agencies decided to put in place in order to prevent transmission was face masks, hand hygiene, and social distancing. These were the core areas or domains of most global public health policy as well as national public health policy. And I'm sure everyone has a box of masks that they've got in their house, and these reminders of the height of the pandemic. As you can see, this is a picture of one of my colleagues in intensive care. So I'm an intensive care doctor and physician, and in my spare time I do aerospace medical research. So during the course of the pandemic, our team joined the NASA Space Apps Challenge in autumn of 2020 to try and derive space-based solutions for COVID-19. This was a hackathon. And we decided to break down our workflow into 3 areas to solve this question. And the main question, the main aim, was to evaluate whether Earth observation, or EO, which I'm going to call it from for the rest of the presentation, is a good potential forecasting tool for future COVID-19 cases. Just an idea we had, and we wanted to see whether this hypothesis was true. And that's mainly because we had read some articles that looked at air pollution decreasing quite significantly in areas of lockdown, such as China. And we wanted to see whether we could use the data that was out there from social mobility, open access data, air pollution data on surface and Earth observation to predict COVID-19 cases, and then to build a tool that would help public health agencies using machine learning algorithms. So as you can see from this infographic from the UN DESA policy, social distancing minimizes COVID-19. We know that from literature. It's something that's been driven forward by different policies locally and internationally. It's part of the global public health solution for COVID-19. It was very important, especially at the beginning when we didn't have vaccines. And the only thing is that these lockdown measures and public health measures were geographically variable. I'm sure that you know this from your own experience. And the lockdown and uplift timelines were geographically very different. And public health guidance was different across borders. So it was very much dependent on your postcode. It was a postcode lottery as to what prevention measures were in place by public health agencies and political communities. So multiple studies, including this one by Cott et al., prove that Google mobility data can be used to indirectly measure population mobility and therefore social distancing. And as you can see from here, Cott looked at Europe and the United States and looked at mobility data using Google and Apple across Europe and Google US data, that the temporal anatomy of social mobility was dependent on lockdown measures. So this is a population-wide measure. It's not what individuals are doing, it's what the whole population are doing. And the data also implied that there was an infection reduction rate in areas with better social distancing adherence. Now, this wasn't the key aim of our study, but this was a starting point that told us that actually mobility data was an indirect measure of social mobility from mobile phones, something very openly accessible. And as you can see, we took this hypothesis forward and built our own database of European capital cities and Google social mobility in these areas. And as you can see, our data also showed, like these other studies, including Cott et al., that Google social mobility data is a good and indirect measure. So we proved this point. And as you can see, more people were at home and less people were roaming around, going to retail stores, going to shopping, going to grocery stores, spending time on public transport, going to workplaces, as you would expect during a lockdown. And more people were spending time in parks. And we looked at London as our primary case study to prove this, and then we looked beyond London to other European capital cities where we could get the data. And you can really see that we proved our point. So we went forward with the project, and our aim was to evaluate EO as this potential forecasting tool for future C-19 cases, and build this tool using machine learning to predict future COVID-19 cases. Just like you have a pollen forecast on the national news, maybe it was time to have a COVID-19 case forecast, especially with regards to severity. So now we come to the next step in our workflow, which is to link social mobility to surface and EO data for air pollution. We know that nitrogen dioxide is a noxious pollutant gas, and you get this from motor vehicles, factories, power plants, industrial facilities. After lockdown in China, we saw a significant fall in mean tropospheric nitrogen dioxide levels. And you could see this from NASA as well as ESA composite satellite images on this slide. And this is from a paper in the Lancet Planetary Health. So it's a very high impact paper looking at this from Gianni et al. And this is from surface pollution stations. So you could see that actually social mobility versus air pollution, you can see that lockdowns decreased air pollution across regions from surface data. So we looked at surface data as well, and we did this for all European capital cities, and we got data for 22 European capital cities that was openly available. And we looked at the time period February to June 2020, and the reason we did that was because it's the start of the pandemic. We didn't have a vaccination rollout, so you didn't have the confounding variable of vaccinations. And you could see a similar trend with carbon monoxide. And as you can see, there's similar trends for surface CO. Less CO means more time at home. But not all surface pollutant markers, or pollutant markers should I say, correlate with social mobility in the same way. There's opposite trends that were seen for O3, SO2 and PM2.5. So the main pollutant markers that were useful were carbon monoxide and NO2. Now, we took this further. We'd made the link between social mobility and surface air pollution data, but we wanted to see whether the same thing applied to EO. And there were papers out there also on this workflow that showed that social mobility limitations and lockdowns equaled decrease in air pollution across regions from EO data. And this was the ESA Sentinel-5 and NASA Aura data looking across China. And you can see pictures of these satellites here as well. So again, this was looking at nitrogen dioxide primarily, but didn't look at other pollutants. And there were even more papers that looked at changes in air pollution levels after COVID-19, and this was in Korea. And what you can see here is again the same observation. Less pollution, but this was changes in PM2.5. So our analysis showed that EO pollution and Google social mobility data across European capital cities. We had two things that were lower, NO2 and SO2 from EO data, and things that increased were PM2.5, total PM and UV. This is slightly different from what was in the literature. So do we need more data? Do we need a different time span? Do we need to actually look at different air pollution data changes from satellite data during uplift and lockdown measures? So this is a GIF or GIF, basically showing you the evolution of what happened to NO2 in the troposphere across capital cities in Europe. And this is from the EO dashboard. So anyone can access this. This is free and open access satellite data, mainly from Copernicus. And it looks across what are the hot points for air pollution and NO2 especially across these capital cities. And this was really one of our inspirations for why we did this work. So we had proven the fact that social mobility could be indirectly measured with mobile data from Google data that was open access. Our next step was to look at mobility and pollution from surface and EO. We've made that link. And our next step was to look at how does EO then help predict future COVID-19 cases. Can we do that? Is that even a possibility? And as you can see, this is our analysis of nitrogen dioxide in London and in Budapest. And we wanted to first establish what was the best lag time. Is it to do with COVID-19 incubation? Is it to do with other factors? And we figured out that 14 days was the optimum lag time from when you measure the surface air pollution data at time 0 or Earth observation air pollution data. This is surface data that you can see on this slide, but we did look at EO as well, versus COVID-19 cases after 14 days. We looked at 7 days, we looked at 14 days, we looked at 21, 28 and 35 days. And we saw that actually the best correlation and the thing that makes scientific sense from a medical perspective was 14. And after this, we actually looked at, okay, if you increase the amount of NO2 in a certain area, does this change the new incidence of daily cases of COVID-19? And as you can see, there was this weak positive correlation that you can see from this graph, and it was something, it was promising from our small data and snapshot of what we could see. So we decided to plug all these numbers in and train an ML algorithm. So far, just to recap, we collected the data from social mobility, Google data. We looked at air pollution across 32 European capital cities, but we only really got complete data for 22. And that's because it wasn't free or open access for some of them. And it wasn't available for all of the different parameters we were looking at, because we weren't just looking at NO2 like other groups. We were also interested in carbon monoxide, ozone, PM2.5, black carbon, and SO2. And once we had established these links, we wanted to look at ground station data and satellite data. So it was a big piece of work, and we plugged all this information together into an ML model. So we had an ML or machine learning expert on our team who basically tried to see whether we could teach an algorithm to build a predictive tool. And we piloted this tool. This is by no means a complete picture. This is just a flavor of what we did. And as you can see from this graph, this was an incredible graph because we wanted to put all the information together into this ML model. We trained the model with the data that we gathered, and the model predicted that air pollution at time 0 from NO2 especially, and COVID-19 cases at T+14 days. But we know, we take a step back as scientists, and we know there's limitations to training an algorithm like this. Now there's a vaccination drive, there's new variants that have different time lags and different incubation periods or times. There's so many confounding variables to the data set now, to a model now. But at the time, for a new pandemic or epidemic, this was a useful tool, a useful forecasting tool, as something that will be useful for future pandemics too. It may also be useful for vulnerable patients who have hematological conditions, for example, who may need to be more aware of the number of cases in a certain area in, say, 14 days. So if you're planning for a Christmas family meal with everyone, then it's useful to know on December the 14th or 15th that actually the number of COVID cases is going to be super high on Christmas Day, and therefore you should probably avoid meeting up as a vulnerable adult or child. So the next step for us is to prospectively test more, think about additional variables and inputs, think about integrating this into a web app to manage resources, and translating this to other future pandemics or new strains of COVID that have different incubation periods. So the true issue at the moment is long COVID, and we have lots of vulnerable patients with long COVID that are susceptible to further infections of COVID, and also patients who are immunosuppressed and vulnerable, older people or elderly people, and kids who haven't been vaccinated, or the unvaccinated population who might be interested in a forecast like this. And our next step is to see whether we can integrate this forecast into existing EO dashboards like the ESA Rapid Action for COVID-19 EO dashboard. So I'd just like to end the presentation there and give you this key link to our poster from IAF Astro, and you can also access our manuscript if you attended IAC 2022, and which is just being prepared for peer review and publication. And if you've got any questions, please tweet me at @AstroMarsRocky or drop me an email. I look forward to hearing from you, and I hope you enjoyed our presentation.